Hello, everyone. So today in this presentation, we're going to be talking about the crisis under our noses. In other words, the opioid crisis, which is something that has gone relatively unnoticed in present times, especially now during coronavirus, which has overshadowed this underlying problem. So I'm going to be going over like the context for the crisis. So according to the World Health Organization, there's been roughly 500,000 deaths related to drug use, and 70% are related to opioids, and 30% are dead from the actual overdose, which is, that's pretty bad. It began in the US in the 1990s. So we had three waves initially in the US, and the first began in the 1990s when pharmaceutical companies reassured like the public and the health communities that people could not get addicted to these prescription opioids. As a result, when they say that it's okay, they're more lenient with handing them out to people that don't necessarily need them. And eventually this led to widespread like misuse, and people began diverting the opioids to other people that they knew, because what was the harm, right? They said that they wouldn't be able to get addicted. And thus it led to the opioid crisis in the 1990s. The second wave happened in 2010 when a lot of heroin use was in our country, and the third in 2013, where other synthetic opioids were used to substitute heroin, and they were mostly illegally distributed.
And to overcome this problem, one thing that we should do is reducing the stigma around substance use disorders. And so those with a substance use disorders are often blamed for their disease, because like the general public thinks that drug addictions are a result from like a weakness of the individual. And this causes those that are addicted to opioids or other drugs to feel shame, and they start believing that their addiction is their own fault. And so when they feel that shame inside, they refuse to seek help. And this causes them to be at a higher risk of overdosing on opioids. And healthcare providers can also add to the stigma because they can provide lower quality care or reject those with substance use disorders and then not allow them to seek treatment. And it's important that we recognize that an addiction is not a flaw or moral failing of an individual. And a drug addiction is a complex brain disorder with behavioral components, and it should be treated as a disease that a patient can recover from. And one of the resources that we found to help everyone take action is Shatterproof. And Shatterproof is a national nonprofit organization that is helping to resolve the addiction crisis in the United States. And we encourage everyone to visit their website, which is linked at the top of the presentation. And I'm going to take you through a little bit of what their website contains as well. So if you see here, this is Shatterproof's website, and they provide a lot of resources. And if you click through the tabs at the top, you can see the tab that says Find Help. They provide education about addiction treatment, best practices for addiction treatment. And then they also highlight the work that they're doing. I'll take you here to Atlas, which Atlas is a resource to help patients find appropriate and high quality treatment options, which is very helpful in treating the opioid epidemic, as more treatment options allow patients to freely seek out help instead of just hiding their own disorder and then developing an addiction and then maybe fatally overdosing. And this Atlas is one of their ways of helping. Another is the Substance Use Disorder Treatment Force. And then this is also a resource that's geared towards helping American drug addicts like find more treatment options. And I'll take you down here. And I want to point out that it says the task force's focus is not to develop more recommendations, but it's to implement change. So if you read down here, their goal is to ensure that every American with a substance use disorder has access to evidence-based treatment, just like those receiving treatment for any other disease. So by doing this, by allowing more treatment and more accessibility to treatment, they're treating drug addiction not as any kind of like special disorder or a mental problem that can't be solved. They're just treating it like any other disease. And right here is where you can get involved. There's a place to start your own fundraising. And what we wanted to point out is um, right here. See how stigma can affect the opioid epidemic. And then once you click on this How You Can Help tab, the important thing is right here. It's not necessary to donate large amounts of money or just dedicate all your time to research the issue. Even taking this pledge, which is pledging to describe addiction as a treatable disease and use empowering language, such as a person with substance use disorder, instead of using words that hurt like addict or junkie. This only takes about a minute of your time, but it takes a big step towards resolving the opioid epidemic. And it's something you can just do right at home. So we hope that you take action and just do this whenever you can, because it doesn't take that much time. If not, we hope that you tell someone else about Shatterproof, introduce them to this website, kind of just like how we guided you through on this presentation, and also educate them on how they can help as well. And I'll return to the presentation.
So yeah, thank you for being a part of this presentation for those that watched. And like Michael said, the most important thing is to bring awareness, right? So if you don't want to really take part in anything, at least get it out there. Just tell a couple people, tell them to tell people, like make it a chain, and eventually it would reach many more people. So, and that's a super easy thing to do. Um, that's it. Just spread the knowledge, and let's make this crisis that is very overshadowed. Let's bring it back to light. Thank
Thank
you.
you so much.